UK mentors with Aspira Education. We will be discussing about one of the frequently asked questions about the MRCP UK preparation, and also about what are the different options are available to enter into the medical system in the UK. Okay, so one of the common question which comes up with the students is that what is MRCP UK and who can take it? Okay, so MRCP stands for Membership of Royal College of Physicians of United Kingdom, and basically it's a diploma degree. Okay, it is not a post graduation degree; it's a diploma degree in medicine, and the student can attempt these exams if you have 1 year of clinical experience. Okay, so that is the basic requirement. So you need to have your undergraduate degree, the MBBS, plus 1 year of clinical experience. So most of the times it's after your internship, when you enter if you have some more additional 1 years of clinical experience, that is the time you can apply for the MRCP exams. Okay, so you need to have some sound clinical knowledge to take this exam. And also it is important that you have some experience with managing clinical medicine. Okay, so that will help you to clear this exam. Now, if you look at the various pattern or various stages of international medical graduates who are entering UK, so this is the sequence of steps which the student has to go through. So you have, let us say you are graduated from the university. This is in the UK, and you have to go through foundation years, which is something similar to internship in India. So that is the time you are eligible to write MRCP Part 1 exam. This is for the UK graduates. Then they'll enter what's called core medical training. So core medical training, where the student undergoes some training in the managing patients in hospitals, and they will be rotated in different hospitals. So this is equivalent to something like an first year postgraduate course in India, and subsequently they enter specialty training. Okay, so before entering the specialty training, you are expected to have full MRCP. Okay, then only you can apply for the ST3, and then so on. And you can this is about 4 years. So at the end of 3 years, you can decide if you would like to sub-specialize. Okay, for example, you would like to take cardiology, neurology, or nephrology. Okay, so then you can go into a specialty training, and you'll end with what's called CCT. Okay, so CCT is basically gives you a certification that you have cleared the subspecialty training and completed it, and you can become a consultant. Okay, so to become a consultant in the UK, CCT is mandatory. Okay, without doing CCT, you will not be given a consultant position, and you will be working under a supervisor. Okay, that is the significance of CCT. Okay, so this is the division, or this is the sequence of, or the pathway for the medical training in the UK. Okay, so you have foundation year, then you have core medical training, then you have specialty training, and then you have CCT. Okay, CCT stands for certification of completion of training, from where you can become a consultant. Okay, now what is the division of MRCP UK exam? So MRCP exam has got three parts. One is called Part 1, which is a written exam. It's a multiple choice question exam where you have 100 questions in 2 sessions. Okay, so morning you have one session which has 100 questions. In the afternoon you have another 100 question exam, and all the questions are of best of 5 format. So there will be a scenario given, and there will be 5 options, and you have to choose the best of the 5 options. Okay, so this is the Part 1 exam. So it includes most of the subjects in the medicine. Okay, in addition, it also has some clinical sciences. That means basic anatomy, physiology, biochemistry, statistics, epidemiology. Although they have a very small fraction, but there will be some question on basic sciences. Part 2 is more of a hardcore medicine question, where they give a scenario pertaining to any of these specialties. Like from question can come from cardiology, neurology, nephrology, or endocrine, and you have to choose the best of the 5 format. Again, there will be 2 sessions: 100 question in the morning, 100 question in the afternoon. So both of them are theoretical questions. Okay, theory based scenarios, and you need to choose the best of 5 format. Okay, The clinical part is called PACES, which stands for Practical Assessment of Clinical Examination Skills. Okay, here the student have to go through 5 stations. Okay, in each station you will have either a communication skill or an clinical consult. Okay, so you have to rotate between different stations in a specified time. The total duration of this exam is about 2 hours and 5 minutes. Each station you will have 2 examiner. One of them could be an international examiner, and you need to clear them each station has to be cleared individually. In addition, there are 7 skills which are graded during these examination. So these 7 skill also you need to pass individually. Okay, so this is a practical exam. So remember, this PACES exam can be attempted after part 1 or part 2. Most of the students do attempt after part 2, where they already cleared the theoretical exam and then they practice for PACES. Okay, so MRCP UK degree is awarded once you clear these PACES. Okay, without clearing PACES, you will not get the MRCP UK degree. Now, how does MRCP benefit Indian doctor? So MRCP definitely gives an edge over other your other colleagues who do not have this degree. Okay, so we can differentiate we can divide these benefit into different sections. Okay, so one in terms of your career. Okay, in terms of career, definitely if you are practicing in an corporate hospital in India, or you are practicing you're just practicing as a general practitioner or private practitioner, so this degree will attract a lot of patients, because they know that somebody who has an MRCP degree will be more likely to have because likely to have more patients, because it is an internationally recognized degree. Okay, and well accepted all over the world. So to get that degree, you need to have some certain basic skills. Okay, so it's widely accepted that MRCP is one of the qualified degrees in the world. So you definitely attract more patients, especially in corporate sector. They definitely prefer a person with MRCP over another person who do not have this degree. Okay, this is in terms of your career. So MRCP UK may not add benefit in the medical college. Suppose you are interested to work in a medical college, or then the MRCP UK will not give any additional benefit. So it's only additional benefit if you are practicing or you are working in a corporate sector. The second important part is if you're looking for monetary wise earnings, definitely MRCP UK can earn, you definitely will be earning much more, especially in abroad. If you're interested to go to certain Middle East countries, so they'll pay much higher for a doctor who has got MRCP UK degree compared to who do not have this degree. Okay, it's very good if you can have at least certain 1 or 2 years experience in the UK. Okay, suppose you have MRCP UK degree, then go to the UK, work for 2 to 3 years, and then come back to the Middle East. Then you will be earning much higher money compared to directly going into the Middle East after completing MRCP UK. Now, is MRCP better option than PLAB? So remember, these are two different options in different stages of your career. Okay, so PLAB is an exam you take immediately after internship. Okay, it's a broad exam where you have to you have paper, theoretical paper, and OSCE. Okay, so you need to clear both theory and OSCE, and then you enter, then register under the GMC, and then enter into UK as a non-training job. Okay, so usually PLAB is attempted after your MBBS, after completion of internship. MRCP requires sound medicine knowledge. Okay, so usually MRCP is attempted if you're doing a post graduation in medicine, or after your MD medicine. Okay, or you have at least 2 or 3 years of experience of working in medicine department after MBBS. Okay, because to clear MRCP you require certain basic knowledge of medicine. Okay, so that is the significance. So if you're going to a PLAB pathway, so you need to clear PLAB 1, then PLAB 2, then you register in the GMC, then you have to enter into the UK, apply for different trust, and ask, look for non-training jobs. Okay, once you have certain experience in non-training job, then you go for core training. Okay, that's what the pathway which I showed in the first few slides. Then you can finish MRCP and then go for specialty training. Okay, now problem which is nowadays students are facing in UK is that this non-training job is a little difficult to get. So even though you have cleared PAB, you are registered with the GMC, getting this non-training job at a much junior level is difficult in the UK nowadays. So it's better that if you have experience in working in medicine, or you're doing MD medicine, or after MD medicine, better to finish, better to do MRCP and go, because once you finish MRCP, you're like more likely to get opportunity than after clearing PLAB. So should MRCP be done after MBBS or MD? So definitely it should be preferably done after MD medicine or during MD medicine. If you want to attempt MRCP after MBBS, definitely you can go ahead, provided you have at least 1 or 2 years of clinical experience. You would have worked with patients in the Department of Medicine. Okay, so that will help you. It's not that post MBBS you cannot attempt. You definitely can attempt MRCP, but the PACES exam will be much more difficult if you attempt after MBBS without any clinical medicine experience. Okay, so definitely I would recommend to do MRCP if you are working in medicine for at least 2 years, or if you are doing MD or you have completed MD general medicine. Now, is it recognized in India? Is it equivalent to MD General Medicine? Definitely, MRCP UK is recognized by the NMC. It is not considered equivalent to MD General Medicine because MRCP UK is a diploma degree in medicine, so it cannot be equivalent to a master degree. Okay. However, you can definitely do practice with MRCP UK because you are likely you have some basic clinical knowledge, so you can practice with MRCP UK, but it is not considered equivalent to MD General Medicine. Now, can we practice in India with MRCP UK qualification? Yes, definitely you can practice with MRCP UK qualification as it is accepted by the National Medical Council. So definitely you can practice with the MRCP UK. So what is CCT and why it is necessary? Is it necessary? So I just showed you the pathway that CCT is core completion of training. So that is given once you complete your post-graduation and the additional training, for example, neurology, nephrology, okay? And so that is it's an exit exam, okay? So once you complete CCT, so you can become a consultant in the UK, okay? So you don't have to do CCT, but remember, if you don't have CCT, you cannot become a consultant in the UK. Okay, so it's always better that once you enter the UK, the training in the UK, complete CCT because which will help you to provide more options both in UK as well as abroad to work as a consultant. Now, how long does it take to complete MRCP? So it depends on how well you're prepared. Generally, it takes about 18 months to 24 months to complete MRCP UK because you need to complete 3 exams. One is part 1, MRCP part 1, which is a written exam. MRCP part 2, again written exam. So this you can clear back to back in 6 to 10 months. Okay. However, the problem nowadays students are facing is about the PACES exam, because sometimes you apply once and twice, you may be waitlisted, you may not, it may be rejected. So PACES has a lot of wait list. So a lot of students are waiting in to get an opportunity to give exam. So if you are lucky, you can finish in 12 months. So generally, I would say about 18 months time may be required to clear and complete MRCP UK exam. Now, can further studies be persuaded in India based on MRCP UK qualification? I would say no, because if you want to have any postgraduate degree in India, you should have either MBBS or MD medicine or DNB. So one of the Indian degrees are necessary. Based on only on MRCP UK, you cannot have additional qualification in India. However, in abroad, for example, Australia, okay, or certain Middle East countries, you can do further studies based on MRCP UK degree, okay, but not in India unless you have some basic qualification from India, such as MBBS, MD, or DNB. Now, how to prepare for MRCP UK? So you can prepare MRCP UK. The first thing would be to go through the past questions. So you can go through a lot of online resource materials or online notes which are available. You need to go through those notes, or you also need to go through the past questions, a lot of question banks. Also, if you have hard time trying to understand basic sciences or some of the topics, definitely we provide courses for both part 1 and part 2. So probably you can go through some of these courses as well if you are not prepared well. So you can join the courses, or you can if you have time, you can go through the past questions and some of the study notes. Definitely one thing you shouldn't do when you prepare for MRCP UK is that you should not go through the textbooks. Okay, you don't have to go through the first year, second year, and textbooks, because it's not required and do not have that much time. The most important is your part is you have to go through the past question in detail, maybe revise it once or twice before you give your attempt. What's MRCP SE? So MRCP SE stands for Specialty Certificate Examination. This is an usually an exit exam conducted in the UK for the subspecialties like gastroenterology, nephrology, neurology, or cardiology. So this is an exit exam. So after this exam, generally they are awarded a degree in the UK. Okay, but if you're training, if you've done your training, cardiology, neurology, nephrology outside of the UK or outside of the European Union, somewhere in India, so this degree will not add much benefit. Okay, so attempting SCE after doing a degree from India will not fetch much benefit because it's an additional certification course. It has value only if you've done that training in the UK. Okay, so if you are passionate enough, you want to give exam, definitely you can give this exam and clear the exam. However, it's just a certification, so you can add in your curriculum vitae that or resume that you can have this additional qualification or certification. But it's mainly for the international. It's mainly for the UK graduates to for the completion of their subspecialty training. Now, is it better to do MRCP UK first than MRCP SE? Yes. So MRCP UK is a medicine, it's an exam based on medicine, and MRCP SE is an exam based on subspecialty, like renal medicine or like cardiology, neurology. Okay. So it's always better to finish MRCP UK first, where you need to go through all the part one paces, which are mainly based on the hardcore medicine, and subsequently you can do SCE exam. So SCE exam is again it's a written exam which has got about 100 question in the morning session, 100 question in the evening session, in the afternoon session. It is something similar to the part 1 and or part 2 MRCP exam. Only thing is the questions are predominantly on the particular subspecialty like cardiology, endocrinology. So it's always additional benefit in terms that you will have additional certification, but definitely you have to do MRCP UK first, followed by MRCP SE. Okay. Suppose you have only MRCP SE, so it's not going to have any additional benefit unless you have completed MRCP UK. Yeah, I think with that we have completed most of the questions which are in your mind. Thank you.